Hello, my name is Arthur Mendiola and I'm going to be doing a presentation on testicular cancer. So cancer is when cells in a specific body part begin to grow without end. When the cells grow uncontrollably in the testicles, it is considered testicular cancer. Testicular cancer is the most common cancer amongst young and middle-aged men. The cancer is mostly about 90% developed in special cells called germ cells, which is also where semen is created. There are two types of testicular cancers, the first being seminomas and the second being non-seminomas. Seminomas. This type of cancer has a slow growth and spread rate. It's most common in middle-aged men. Within the seminomas, there are two subtypes. First is classical, which is very common, about 95% of cases, and occurs between the ages of 25 and 45. The second is spermatocytic. It's rare and grows even slower and usually doesn't spread to other parts of the body. It occurs usually over the age of 65. The second is non-seminomas. It occurs between the late teens and early 30s. There are four types. First is embryonal carcinoma. It's partially found within 40% of cases and fully present in 3 to 4%. It grows rapidly and spreads outside the testicle. The second is yolk sac carcinoma, which is most common in children and infants. The third is choriocarcinoma, one of the most aggressive types. It's found in adults and spreads fast to different organs of the body, including bones, lungs, and brain. The fourth is teratoma, which is extremely rare. The symptoms. Most of the symptoms are not painful. The most common symptoms are swelling and presence of lumps. Aching or heavy feeling in the lower abdomen or scrotum is another symptom. In rare cases, there's growing and soreness of breast. There's also rapid puberty in young boys. When the testicular cancer is in an advanced stage, there is low back pain, headaches, belly pain, chest pain, coughs, and or shortness of breath. The most common way to diagnose is by looking at the cells through a microscope. Another format is transillumination, which is when a doctor holds a light to the lump of the testicle, and if the light does not shine through, it is considered cancerous. Another method is the ultrasound of the scrotum. For treatment, testicular cancer has a 95% treatable and curable success rate. After the cancer is found, identifying the type and stage of the cancer is crucial. There are three stages. The first stage is when it has not spread beyond the testicle. The second stage is when it has begun to spread to the abdomen. And the third stage is when it has spread beyond the abdomen, so perhaps to the lungs, liver, or brain. There are three main methods for the treatment. There is orchiectomy, which is the removal of the testicle, radiation therapy, which uses high energy rays, and the third is chemotherapy, which relies on drugs. Causes and prevention. The cause of testicular cancer is currently unknown. Factors believed to provoke the cancer is exposure to chemicals, family history, HIV infection. There are no proven scientific prevention methods, unfortunately. The best advice is to perform a testicular self-exam every month and be aware of any changes. The sooner you catch it, the better the changes are to treat and cure it. For the statistics, American and European men are more prone to testicular cancer than men from Africa or Asia. There is no current reasoning. Specifically, white males are more prone to testicular cancer as opposed to any other ethnic group in the United States. That has been my presentation of testicular cancer. Thank you for your time.